Hi, this is Sean McGuire with Bellis, and I am joined by
Ginger Reevy.
and we're going to be talking today in this webinar about the top things that have caught our attention during the first 100 days of the Biden administration. We'll be looking at some of the major changes in federal health policy over the last 10 years, looking at some of the COVID-19 relief packages, and some interesting stuff about the future of healthcare, Ginger.
Yeah, some really interesting stuff going over the American Rescue Plan and just like in terms of the future of healthcare, stuff about medical robots and 3D printing and all those things that we're expecting to see.
It's going to be really interesting. You're not going to want to miss it. The only thing that we ask in return is that you hit that like button for us and don't forget to subscribe.
This is Sean McGuire with Bellis and host of America's Healthcare Challenge. I'm joined today by Ginger Reevy, and we're going to talk about the latest changes in healthcare, look back at the last decade, and a few other fun things that are catching our attention. We'll also be talking about how the COVID-19 pandemic has changed the healthcare landscape and potentially your experience. And we'll conclude by looking into the future a little bit, trying to forecast what we may see happening in the next several years. Ginger, thanks so much for being here today.
Thank you, Sean. It's good to be here.
Ginger, I know you've been a great help with us here at Bellis, looking at some of these things. Can you give the audience a little bit an idea about the background of some of the things you've been looking at as you've been preparing for this webinar?
Yeah, of course. The areas I've been focusing on during specifically the 100 days of the Biden administration have been a lot of primarily research on the American Rescue Plan, since that's been one of the biggest pieces of legislation we've seen so far. And in terms of the webinar's focus, you touched on this, but we're going into detail on the American Rescue Plan, as well as other bills and laws that have been passed in the past 5 to 10 years, as well as a look at the future and what advancements we're expecting to see. But why don't you kick things off with a discussion of what's happening, and then we can dive into more details as we get into the presentation.
Sounds terrific. We'll be tag teaming this here today. I'm going to start by talking about the last decade, some of the things that we've been paying attention to, and we're going to look at some of the major health reform efforts and policies that have changed since the Affordable Care Act, which, as you may or may not know, is a focus, a law that we focus heavily on at Bellis, because it's such a massive piece of public policy that it has changed how healthcare is delivered. But there's been some other laws that have passed that have also had some changes that might have affected you that you may not have even known about. We're going to talk a little bit about those. Some of those laws include MACRA, Trump's executive orders, and others. And MACRA is what's the acronym for the Medicare Access and Chip Reauthorization Act. It was passed in 2015. Our website has an article breaking down some of the high-level details of the law. Major thing is that it really took what the ACA started in trying to push for a quality, more quality of care, more attention paid to that, and introduced certain programs that healthcare providers now have to do in order to get reimbursed through Medicare. But there's been a lot that's happened to it, and it's also authorized or essentially made permanent the Children's Health Insurance Program. Another federal piece of legislation, the Better Care Reconciliation Act, really addressed, more of the, I guess I would call it, financial aspects of healthcare, giving states to insurers and other things. Next on the list was Trump's executive order, which, as you know, they tried to repeal the Affordable Care Act several times over the last decade. All of them unsuccessful. They almost got it replaced through the American Health Care Act, but as you may or may not remember, John McCain ended that in dramatic fashion on the Senate floor by
they're making the rules up as they go then. Oh my God, don't do this. No. Oh my God. Oh my God. John, don't do this, John. Good God Almighty. No. Jesus Almighty. So cold.
some people think it was almost a revenge towards Trump, but others could say it was because he was going through healthcare conditions himself, and he passed away shortly thereafter. So they decided, as after that failed, to act through executive action, and something that a lot of folks have seen and some people have benefited from if they're healthy has been moving towards different products in the health insurance market instead of just Obamacare plans. So these would be like tri-term medical and short-term medical plans. And, they've made a push for association health plans as well, and attempting to use HRAs and health savings accounts, but in particular HRAs, for employers to pay for employees' healthcare costs. After that, was passed, the focus changed towards the opioid epidemic or pandemic. I don't know. What would you call it, Ginger?
Probably an epidemic. Yeah.
Yeah. Did you learn about some of that?
Yeah, we have. We've been talking about that specifically in Illinois. It's pretty bad.
Oh, really?
Yeah.
So the Interedict Act, I believe is how you pronounce it, signed in 2017, really tried to address some of these things, trying to find ways to detect and intercept these. What are these synthetic opioids? Is that something like fake opioids, or what is it?
Yeah, I think a lot of them are laced with different things as well, like when they get them on the black market and stuff, and that makes them extremely dangerous.
Wow. Yeah. And obviously, we know fentanyl has been a major problem, and that's been been smuggled into this country from all different sources. The right to try law was something that they signed that is the FDA has a process for approving clinical trials, and this allowed somebody, if you're essentially in an uncurable, life-threatening condition, you can actually try some of these experiments before they're approved. I think I would probably try something like that.
Yeah, if you have an incurable, life-threatening condition, I can't imagine why you wouldn't break down these barriers. Yeah.
Right. So, this link, and we'll put all these sources online and links to them so you can see, but you can see the link to more on that of the FDA. This Mental Health Access and Improvements Act, this is actually just recently signed, it looks like, doesn't it? And we've seen a lot of issues with mental health, especially with the pandemic. Have you noticed that?
Yeah. It's become a big problem.
Yeah. So the goal of this was to expand mental health care professionals to care for Medicare patients. We're facing a shortage of healthcare providers all along the board, but I think we're probably facing a shortage of mental health care providers too.
So those were all very interesting laws and bills that have been passed in the past 5 years. But in terms of COVID, what have we been seeing in the past year? Have there been equally as many laws passed? Has it been harder, easier?
Well, it seems like there's been a lot of activity, doesn't there?
Yeah.
And I noticed that the economy was growing really good this last quarter, but I think a lot of it could be because they've dumped so much, federal tax dollars into the economy. We're going to get into, some of these laws, but we saw going back to March 2020. By the way, I found a journal article the other day, which was interesting. It was written like at this time last year. It's kind of weird. Do you remember how you felt like, last year at this time?
I remember thinking this was going to last a month, which is extremely naive.
You
but
thought
yeah,
it was only going to last a month?
I really thought it was a month. Yeah.
And then so here we are, still wearing masks. So and they're still acting legislatively. So Coronavirus Preparedness and Response Supplemental Appropriations Act. So that looks like they just so that was the first response, and that was only $8.3 billion. I say only, but when you get into the $2.3 trillion that they spent in 2021, they really kind of stepped it up a notch, didn't they?
Yeah, definitely.
So we have the three programs in 2020, then the Paycheck Protection Program, which was for businesses with loans. By the way, I think the Los Angeles Lakers also got the Paycheck Protection program loan.
Oh, really?
Yeah, and they won the championship. So I don't know if the taxpayers are like, had something to contribute with that. And then more appropriations, and then that brings us to the American Rescue Plan.
Yes.
What did you think of this law as you were going through it?
It's a lot to unpack. Definitely a lot of different things going on in it.
Yeah. So we're going to try and do our best to go through it. It was quite controversial because some of these other laws that were passed and these other slides were passed with bipartisan support, especially the first couple of ones. But that's kind of where you get into the controversy of this new American Rescue Plan. Is it too much government intervention, and can we afford it? Did they really need to go that big at that time? Why are so many provisions not related to the pandemic? Interesting question. And will they have to be funded again? That's a big thing. Once you introduce a program, we have to fund it. Passed in March, so a little bit over a month ago. Mitch McConnell referred to it as the worst piece of legislation he's ever seen in his time in Congress. Is one of the largest laws passed in modern history, and it's now the sixth effort related to COVID-19 with a $1.9 trillion price tag, which could go up. So I wanted to show this side because I always watch, I like shows like Narcos or, crime shows where they're buying something with like a suitcase full of cash. And I always wondered how much money's can fit into a suitcase.
Right.
It looks like $1 million could maybe fit in a suitcase if you look at the guy right there next to $1 million. Yeah, and those are all $100 bills, by the way. And then so the next one there is $1 million, $100 million. Looks like it's on a pallet, and then you could probably fit $1 billion into a storage shed. Maybe that'd be kind of fun. But then you see $1 trillion, and that's wanted to show you the scale of how large some of these efforts have been.
It really puts that into perspective when you look at it.
So you want to take us through kind of breaking it down a little bit, where it's going?
Yeah, I'll highlight some of the biggest money allocations throughout for the $1.9 trillion. So first of all, they offered $1,400 per person for stimulus checks, as well as $128 billion in grants to state educational agencies, as well as $39 billion in grants to higher education institutions. So just focusing on the education.
So you think that's to train more healthcare workers, or?
I could see that as a goal.
Definitely. That $1,400 per person, not for every person is below a certain income amount, but a lot of people received it.
Right.
Continued payments on this, what is this, unemployment insurance, so that's going to still go on. And this is a big one, is the expanded child tax credit from $3,000 to $3,600 for children under the age of 7. So that's just the beginning. We're just scratching the surface. What else do we have? $30 billion for transit cost. Okay. So creating personal protective equipment. So that'd be like masks and stuff like that.
Yeah.
What else got your attention?
And then it looks like there's $37 million allocated to the Commodity Supplemental Food Program for low-income seniors.
Yeah.
And then $15 billion will also be allocated to support workers in the airline industry. It looks like airports are also getting a cut.
Mental health continues to remain a serious concern, and they've shown that there's been increases in all of these things that they're trying to prevent. So we've got $3 billion for block grants to state and local governments to address mental health and substance abuse disorders. And this will get into the workforce, because we've talked about the shortage of physicians that we're facing, for example. So they really are throwing a lot of money out there. It's just, when you pass something this huge, it's hard to really understand. It just takes a few months for people to dig through everything.
Yeah.
We talk about the 3 legs of health policy: access, cost, and quality. So access, they're working on that, and this is a big slide to highlight the fact that they are fulfilling a campaign promise to enhance and expand the Affordable Care Act. And so they have done that by providing incentives to states to expand Medicaid. And also, this is going to benefit certain people that maybe don't qualify for subsidies now, but they're going to get a little bit of financial help because there was kind of a cliff, meaning that if you make over 400% of the federal poverty level, you wouldn't get a subsidy. And that would be really tough for somebody that is older because their premiums, as you get older, your premiums get higher. So this is going to kind of help some people in that boat. And it's going to help people with lower incomes as well get access to even more affordable coverage. So this is a big deal here, this expansion of the ACA. It's only for 2 years, but I could see them continuing this.
Yeah.
So it looked like economic growth, 6.5%. And that's about what it ended up being. So, which was pretty good. I think a lot of it was because of the money being dumped into it, but
yeah,
still, I'll take it. And it should be good for the healthcare industry. For taxpayers, it just remains to be seen. I wish this pandemic would go away so we could move on to other things.
Me too.
You too, yes. If you were to criticize this law, it could risk inflation. Our country remains in debt, and even though Republicans don't really seem to care about it as much as they used to, they're starting to talk about it more, for example. And then we've got this infrastructure bill potentially on the horizon, which is another one. Is there enough real capital, which is money, but another term is political capital? Is there the political will to get all these things done? Just going to have to wait and see what happens. There's going to be some continued unknowns with implementation and perverse incentives. And a perverse incentive, is that people might not be wanting to work because they could get more through these programs. That's
right. So that was a look back at stuff that's been happening. But looking into the future, we've seen a lot of advancements that are happening due to this pandemic and also just in general. One of those being an increase in technology in healthcare. So that's Apple and Google and all those companies getting involved in creating technology for healthcare. So an example of that would be Apple's Apple Watch. It's actually been proven that it's accurate as a clinical heart monitor, which could be implemented in necessary monitoring of elderly patients with cardiovascular disease. And then just in general, COVID-19 contact tracing apps and stuff like that has been very helpful.
So these would be like wearables? Is that what they're calling them?
Yeah.
Do you have an Apple Watch?
I do not.
No? Okay.
I have a lot of friends that have them, and they give them a little notification that they need to stand up and
really?
walk around for a bit. Yeah.
I had a Fitbit for a while and I did that too.
Yeah. It's like guilt tripping you into it.
Right.
So healthcare tech has some pros and cons. Pros would be new advances for the medical field, easier telehealth for millions of patients, and just generally connecting with patients. Also, there has been a strain, as we've talked about, with healthcare workers and not having enough staff for that. So this would be easier to see a volume of patients and people to self-monitor. Some cons, though, would be that technology adopted by these companies like Walmart, Apple, Microsoft, all that, they're not bound by HIPAA most of the time. So that could lead to issues with data being hacked and breaches in the hospitals and all that kind of stuff. Also would be difficult for elderly patients to figure out new technology. So
they say medical records are worth more on the black market than. Have you heard that before?
I haven't, but I don't doubt it. Yeah.
This is an interesting one, this 3D printing.
Yeah. I know they're not saying this is too near future, but it seems like an interesting thing to touch on. So this is just 3D printing of organs, which would help with the organ shortage, and just give people who are on the transplant list a glimmer of hope, I guess. They're not too far in this process, but it seems like an interesting one.
So like the days of having to like go try and find a kidney from somebody,
Yeah, will maybe be over,
that'd be
which
nice.
would be crazy.
Print a new one.
Yeah.
Could there be a problem with your cells, detecting a new? Wasn't there something like that?
Yeah, I think your body can definitely reject
That's what I was wondering.
it. Yeah, I think what they're doing with the printing though, they can kind of customize it. Like it's your own customizable kidney. You can just, yeah.
Interesting.
There are also some pros and cons with the 3D printing. Obviously, a pro would be ending the organ shortage and allowing people on the transplant list to be saved and not have to stress about all of that. Once 3D printing, organ 3D printing is feasible, it can be applicable to like many other things in the medical field. So more advances in that sense. And then some cons, though, it's extremely, extremely time consuming and labor intensive for researchers to create the organs. It's also an extremely costly process. And there are years of research and testing that need to be put in place before it's safe to put in humans. So it's definitely a high cost, high time consuming process.
But could have high rewards.
Right.
A little bit more resources on that. What about this one?
Yeah, then we have medical robots. All this seems so futuristic.
I know.
But these would be good. They've actually come up with this robot called Violet, and you just put it in the room and it disinfects the room in 15 minutes, which is really cool and like helpful for COVID for sure. Because I think it takes a human 60 minutes to do the same task. So this would just take the burden off of like medical staff from doing like easy tasks that like a robot could do. Yeah, just easy and efficient healthcare, which would be beneficial for both patients and doctors.
Right, because I think the last recording we talked about how 4 in 10 healthcare providers are considering leaving because of burnout. And so this might help them. Yeah, like it took people 60 minutes to clean something and they can do it in 15 minutes.
Yeah.
Make their jobs a little easier.
And we don't need doctors like disinfecting a room, right?
Right.
It feels like. Then for this, again, there are pros and cons. It would lower the rates of hospital-acquired infections. So if we have a robot disinfecting everything 24/7, we're probably going to be less likely to have hospital infections. Contactless care, so reduce disease spread. So a doctor isn't like seeing a bunch of different patients and taking germs with them as they see these different patients. Also, there are robots that actually draw blood and they're a lot more accurate and they have like a steady hand and it's like precise, which is nice. So no more getting poked. And
would you do that?
That seems a little scary, but yeah.
You would?
Yeah, I think so.
Okay. I don't know if I could do that yet. I don't know.
Yeah. Some cons though, also they're very expensive, like the 3D organ printing. They're also breakable and hackable, which is definitely something to consider. Outsiders could get a hold of like our robots doing these tasks, and that could cause major problems.
Right. This is a hot topic, the vaccine topic, huh?
Yeah. Yeah, there was a lot of information on this for sure. It was just like programs to like kind of dispel, I guess, false information that's been circling about the vaccines and stuff. Focusing on algorithms, VR, and innovation in order to mitigate this problem. So algorithms would provide data to technology users that they can resonate with. So like the same process Netflix uses for suggesting like future shows. Yeah, so like provide information that people would be more likely to, I guess, pay attention to.
Okay.
Yeah, and then VR can screen patients who have had the vaccine and dispel any deadly side effects or anything of that sort. Dispel that they had any deadly side effects and all that. Also, innovation could be sending out like text messages to inform the public of how important and safe the vaccine is, and just like outsourcing data and stuff like that. Again, pros and cons. Pros, more peace of mind for the public. Getting the vaccines, they would know that it's safe from like multiple sources. And a lot of people would, or hopefully people would be convinced through these methods that it's okay to get the vaccine and that nothing dangerous is happening. Some cons though, possible like groups who are anti-vaccine. This could be, or they could claim that they're being like silenced if their false information is like being flagged on the internet or anything like that. And if we're sending out text messages, people could see that as like coercion, and like skepticism could rise because of that.
Okay.
It's a tricky situation. And then I think this is our final one.
Right.
Just investing in digital health. Because of COVID, like technology, all those are at an all-time high in terms of demand. So exploring like ventures with investing your money in digital health is pretty lucrative right now. Yeah, they're saying this is the time to get involved in the industry. Really? Yeah.
Any companies catch your attention? Got any stock tips for us?
I don't know, not yet. I'll do some more research.
Okay. It seems to me that it is going that way, though, doesn't it?
Yeah, this is finally showing us how like important it is to have this stuff in place.
And we always talked about telemedicine, and I think now it's going to be even more normalized.
Yeah. So again, pros and cons. The opportune time to invest, like I said, is now. The market's finally matured enough for it to be like, I guess, safer to invest, because like startups are past their first or second year. Health services and remote care is at an all-time high in terms of demand. There are serious payouts with like telehealth and stuff like that. Some cons, actually, these are some companies that have had some trouble in the past. So companies like this involved in digital health, because it's such a new thing, they can falsify data, and like you don't know which companies to really trust. So you have to do like a lot of research before investing. We recommend lots of research.
Right.
Because this one company, Theranos.
Yeah. Did you know? There's a whole documentary about them.
Oh, really?
Yeah.
Yeah.
Yeah, it's a total scam.
$400 million in startup money, and it was a scam.
Oh, yeah.
That's crazy.
Oh, yeah.
Yeah, so there's definitely high risk in doing this.
Those are some of the things that we've been watching, I guess, the last 100 days. It's already 100 days in the Biden administration, so we wanted to talk about some of the things in the next 100 days that you might be seeing. And for more information, we've got all of these links, and we'll post this to our Facebook page, to our social media channels. You can check out edbellisinc.com if you would like to learn more information. And we really appreciate you taking the time to watch. Ginger, do you have any final remarks?
Thanks for listening. Hopefully this gave you some insight into what's been happening.
So as you can see, we'll have some links to more reading if you wanted to learn more about these healthcare technologies. And we encourage you to check out our podcast, America's Healthcare Challenge, which has
We did cover a lot of stuff in that presentation. Thanks so much.
We did.
So if you would like to learn more, want to find out more information about healthcare, or just want to stay on top of some things that might really affect you down the road, make sure to check out America's Healthcare Challenge on Facebook. Check out our website, edbellisinc.com. And we're also there on Twitter with a paper every day that's got the top health stories at America's Canary.
Now that you've heard of Sean McGuire and HealthReformExplained.com, maybe it's time for his team to assess your company's situation. We have innovative strategies to help navigate this new maze created by the Affordable Care Act. For more, go to HealthReformExplained.com.